A colposcopy is a simple procedure that allows a doctor to get a closer look at the cervix. The cervix is the lower part of the uterus that connects to the vagina. A colposcopy uses a special magnifying device called a colposcope. This device shines a light and magnifies the view of the cervix. Don't worry, a colposcopy is a safe and generally painless procedure. This procedure helps doctors identify any abnormal cells or areas on the cervix. It is an important tool in the early detection and treatment of cervical cancer. In this essay, we will delve deeper into the world of colposcopy, understanding its purpose, procedure, and significance. A colposcopy is usually performed if a woman has had an abnormal Pap test. A Pap test is a screening test that checks for cervical cancer. If the Pap test shows abnormal cells, a colposcopy is done to get a closer look. This helps the doctor determine if there are precancerous or cancerous cells on the cervix. During the procedure, you will lie on an examination table with your feet in stirrups, similar to a pelvic exam. The doctor will then gently insert a speculum into your vagina. The speculum is a metal or plastic instrument that helps to open the vagina so the doctor can see the cervix. Once the speculum is in place, the doctor will put the colposcope near the opening of your vagina. The colposcope does not touch you. The doctor will then look through the colposcope to get a magnified view of your cervix. If any abnormal areas are seen, the doctor may take a biopsy. A biopsy is a small sample of tissue that is removed and examined under a microscope. There are different types of colposcopy, including standard colposcopy. This is the most common type of colposcopy. Dynamic colposcopy. This type of colposcopy uses special filters to look for abnormal blood vessels. Chromoscopic colposcopy. This type of colposcopy uses special dyes to highlight abnormal cells. Before a colposcopy, you should avoid using tampons, douching, or having sexual intercourse for 24 hours before the procedure. You may also be asked to take a pain reliever before the procedure to minimize any discomfort. After the procedure, you may experience some light bleeding or spotting. You can go back to your normal activities right away. However, you should avoid strenuous activity using tampons, douching, or having sexual intercourse for a few days. While colposcopy is a generally safe procedure, there are some contraindications. These are situations where it is not advisable to perform a colposcopy. For example, colposcopy is not recommended during pregnancy. Additionally, if you have an active pelvic infection, the procedure may need to be postponed. In conclusion, colposcopy plays a crucial role in women's health, particularly in the realm of cervical cancer prevention. This safe and relatively painless procedure allows doctors to take a closer look at the cervix, identify any abnormalities, and recommend the most appropriate course of action. If you are scheduled for a colposcopy, understanding the procedure and following pre- and post-procedure instructions can help ensure a smooth experience and optimal outcomes. Remember, early detection is key.